Professor Dr. Kolte, first of all, I want to thank you for taking the time out and coming out here today. You and I have been working on this project for the last 7 months. And in that process, we have built the lab in Pune. We have gotten the lab certified by Motic, had the good fortune and opportunity for you to join us in our training in Xiamen. All of these things we have covered before. And we are sitting down for the first time after our Vancouver trip, where we got a chance to interact with people who invented this technology, let alone people who are pioneering the future of this technology with the whole fluorescence thing. So coming back to in the context and the agenda of this conversation here, it's really that it took us a little bit of time to understand these things. And what we are trying to do is we are trying to develop certain communication strategies, which strategies will work at scale across demography, geography, and culture in India. Mm-hmm. So the one key realization I had was to understand what the role of family that plays in a normal person's life in India, and how the overall risk of major cancers can be reduced very significantly using our DNA ploidy test. So basically the way we will go about conversing things is just general strategy. So what we want to understand first is the landscape, how the medical landscape in India, how it operates. So for example, one can clearly say that a lot of people go to public hospitals, and those who can afford, they go to private hospitals. I mean, that much we know. Within that, there are very large hospitals, all the way down to very small practices where doctors are entertaining half a dozen patients a day. So it's a very wide-ranging, very huge ecosystem in the medical sphere. So our intention has been to work with people who want to work with us, and the people who want to work with us typically have a volunteer spirit, and they typically have a desire to do something better with their work, basically, do some world-class work. So in that context, how do you see, the very specific question is, I mean, what do you want from us, the small team at MyDNA Labs? What support and what steps do you think that we should take as a guidance from you in the coming month of June, when we are formally feeling confident that yes, we can make promises in the marketplace and we can keep those promises in the marketplace. And making promises is easy, anyone can ask Modi, but keeping them is difficult. But now we feel confident that the promises that we will make in the marketplace, we can keep them. So now that we feel that confident, we have invited you today to basically share your heart, share your mind on what your advice for us is. From strategic perspective, our goal is that key people and key institutions figure out a way on how they can communicate to the masses that this test can save their family from, catastrophe.
I think when I first met you in October actually, I was not knowing anything about this test. And then when you told me about this test, that how this research has been done, and I went through the papers and all the research papers, I found out that this is a valid test and this does have importance in India, definitely. So that is the time when I started feeling that first, let us be very confident. Let our base be very confident, Mm-hmm. So our techniques should be established, the quality control should be of the highest degree, the training of the doctor as well as the technicians should be perfect. Once we achieve this, and once we feel that yes, we can now approach to the society, then and then only we should proceed and then make this available to the patients. So that was my first intention of getting myself trained. So that was done by doing reading of many research papers. Then I came with you to Xiamen, where this test is going on for more than 6 years, 7-8 years, and it's been done on 8 million patients. And that is the laboratory where I could see how the workflow is and how the test is actually done, what is the steps are, and how they are maintaining the quality control, or what is the software that is going behind this. And in those 3-4 days of intense training, I learned that this is doable. And I got my confidence level high, and I got trained very, very specifically and intensely. So after coming from there, then I had a vision of setting up our lab to that standard. Though the sample numbers are not that high, we did around 100 to 120 tests as tests, not for reporting, but for doing this, establishing this test. And I'm happy that our technicians are getting hang of this, and our quality control is very high. Now that we have done this, I'm ready to go and meet the doctors and the institutes and talk in front of them, because I have seen the institute in Xiamen, and also I went to Vancouver where I met the Dr. Professor
Callum
McCauley, who is the director of this, and
Dr. Branko
Palsis. Yes, those who invented this test 15 years ago. The technicians who were there were telling us that this we did in our laboratory 16 years ago. So it is an established technique. I could see the work that is done behind this, and my confidence level still increased a lot. So now, Rahul, I think we are ready to serve the society, and the cause is to bring down the incidence of cancer in women for cervix, and women or men for oral, which is very high. For oral cancer, it is very high. This test is so simple that whatever we have to do is we have to take the brush, and so the patient doesn't have to suffer the cut or the bleeding or the tensions. So it's very easy to collect, very easy to send or process. The sample collection kit solution is very stable, and so it doesn't get spoiled till it reaches our lab, and then the test is perfect.